if you've ever been feeling a little off colour and gone online for some answers, I reckon you'd, be pretty normal. I do it all the time. It's easy to check medical information and health ideas on the internet, but of course there are dangers as well. So what are they? Well, let's check in with Dr. Steve Ellen from Melbourne's Alfred Hospital. Very good morning to you, Dr. Steve. When you balance it up, is the internet a safe source of health information, or do you think it's worrying people unnecessarily?
Well, the internet's fantastic in so many ways. There's heaps of good information, but of course there's a lot of traps to use in the internet. And as you know, Aussies in particular use it much more than many people in other countries. And the average Aussie spends around about an hour a week looking at health sites. And whilst there's a lot of good stuff, there's really a lot of traps and a lot of what I'd probably call quackery on the internet as well. On the internet as well.
And Steve, my wife is a big fan of Dr. Google. She sees him all the time. What are the dangers? Because one of the problems I suspect is when you're going looking for something and then, of course, you find what you're looking for. It spits out what you put in.
Yeah, look, there's real traps. I'll start with when you go to a doctor. Doctors are trained, or any clinician, they're trained for years in diagnosis, knowing what's common, what's likely to be occurring in a given person and in a given place. The internet, on the other hand, when you throw in a search term like, say, headaches, anything can come up. And in particular, the more serious things are likely to come up way more commonly than the things that are less serious but occur more commonly. So it's risky. People look at the internet and they're likely to be led down the garden path. They're likely to find diagnoses that really are not realistic. They can panic, or worse still, they can head down the path of going for unnecessary treatments. For unnecessary treatments.
It must be heaven for a hypochondriac. The latest trend is something called crowdsourcing your diagnosis. What is that exactly?
Yeah, crowdsourcing is really fascinating. I think this will grow and probably get better as time goes on. But in a nutshell, crowdsourcing is when you use the internet community to do something. Sometimes it's raising money, or sometimes it's getting an answer to a tricky question. Oh, right. So with crowdsourcing, you jump on board, you put in your symptoms, often anonymously, and then online so-called medical detectives give you ideas about what's wrong. Now, some of the sites are really well organised, and after the medical detectives give you some sort of information, the site then collates the information and gives you pretty clear advice about what to do. But it can be risky, of course, because you might get all sorts of people who are, medical detectives without much medical experience giving you their thoughts. It's giving you their thoughts.
To me, crowdsourcing sounds quite worrying and risky, as you say. What advice can you give people about going online to try and get some legitimate help? Where should they go?
Well, there's a couple of things you can do. The most important thing is whatever information you get on the internet, you discuss with your doctor or your nurse or the person you're seeing, your clinician, your naturopath, whatever. So you take that information and talk about it. And then the second thing you can do is think carefully about which sites you'll look at. There's a heck of a lot of really good sites out there, like for mental health, Beyond Blue is fantastic, or Sane. For general health advice, things like the Better Health Channel. Now, these sites are all largely government funded in one way or another, and as a consequence, they've got a whole lot of rules and regulations. They have to be fact-checked by a whole lot of senior clinicians, and so all the information on them is high quality. So, that's your number one step. Look at the site you're going to, figure out if it's quality, and then take the information to your clinician.
Well, we've got you, Dr. Steve. Do you reckon you can diagnose what's wrong with Joe? He's been hacking up a lot.
I just coughed, so I think I must have lung cancer.
I heard the cough, and that's what I was worried about too.
Yeah, thank you.
Dr. Steve, thank you very much for that. We do appreciate it.
Well, you know, you get a headache, you go online to figure out why. Well, lots of us do it. I do it. In fact, the Pew Research Center says 59% of adults who use the internet have searched for health information in the past year. 35% say they've gone online trying to figure out what medical condition they or someone else might have. The problem is some of us overdo it. Some of us become obsessive about it. And that's a condition experts call cyberchondria. There's actually a name for it. Here to tell us more about it is Dr. Janet Taylor. As always, great to have you with us, Doctor.
Thank you. Thank you.
So it's kind of like if you're a hypochondriac and you have a computer, chances are you could be on the road to cyberchondria.
Bad combination.
Yeah, well, I mean, the thing to remember is we've all done it, and most people go on looking for information to make them healthier. But there are a few, almost 25% of people who will go on with a vague pain, a vague symptom, go online and be convinced that, you know, they're going to die tomorrow.
The worst case scenario.
The worst case scenario. So the issue is sometimes people self-diagnose themselves, which means they look for self-treatment, and they don't go in necessarily and see their doctor, or they go in and see their doctor too much, and the fact is they don't have anything diagnosable.
Okay, so with all of these potential places to go searching, there's got to be good sites and bad sites. What can you tell us?
Right. And the key is not to stop searching, because we are medical consumers and we need to be informed. But if you consumers, and we need to be informed. But if you are going online to look for a site, you want to look and see who's managing the site. So institutions or government, for instance, MayoClinic.com or WebMD.com. CDC.gov is great because not only do they have wonderful information, but they also have Spanish. So if you're Spanish speaking, it's easy to find out the information. You want information that's current and evidence-based, and most importantly, you want information that you can understand. So if you go on a site and it's hard for you to understand what they're saying, find another site, but one that's reputable. And you don't want to go on a site that asks for personal information or that you have to give a credit card or money.
And eventually talk to that doctor if there are questions.
That is the key. I mean, nowadays, it is a partnership with your doctor. You can go in with information. I love when my patients come in with questions and they said they have found this online. But you also have to be willing to communicate with the doctor and have the doctor communicate with you, because at the end of the day, it's all about your health.
So, living with a few cyberchondriacs, I've just got a question. What's the real problem here? Is it the chance that you're misdiagnosing, or is it the stress that is created by looking at something and maybe perhaps thinking it's a lot worse than it is?
Well, it's a combination of both, because certainly with hypochondria, the difference is how much anxiety you have, how much you think about it. There are some people who are so convinced they have an illness, they stop going to work or they stop having relationships. So it's about acknowledging the anxiety, but also the fact, if you're in doubt, go check it out. Talk to your healthcare provider and make an informed decision. Don't just diagnose yourself online.
Okay. Dr. Janet Taylor, thanks for being with us this morning.
Good info.
Thank you.
Yeah.